Good evening. This is Dr. Kishan, radiologist. Today we are discussing one small interesting case with a history of hypertensive urgency and referred for a CT scan after ultrasound which revealed bilateral hydroureteronephrosis. This is the scanogram and this is the plain CT KUB. And as we see that there is bilateral hydroureteronephrosis. You can see that there is hydronephrosis, and these two are the dilated ureter here. And as we go lower down, these ureters are still dilated, and as we go lower down, again the ureters are dilated, and they are opening into the urinary bladder. And you can see that the urinary bladder is trabeculated. You can see this. There is a small diverticula here, and the urinary bladder appears to be thick-walled. And as we go lower down, even the prostatic urethra appears to be mildly dilated, and left periurethral prostatic utricular cyst is also seen. And on careful examination, these are the coronal set of images. You can see that there is a gross hydronephrosis, and the renal cortex is all thinned out, and here also it is very much thinned out. And you can see the ureters here. These are the ureters, and you can see both the ureters are going lower down, and this is the bladder which appears trabeculated and mildly thick-walled, and this is the dilated prostatic urethra. Whenever we see such appearances, we need to look at other structures also. And when we look at the sagittal images, something is striking here. Whenever we see here, see the sacrum, what's happening? The sacrum is dysgenetic. And when we carefully look at further soft tissue windows, on careful observation, we could make out that there is a tethering of the cord also there. See, the cord should end at L1, but it is coming all the way lower down, and it is got tethered because there is a dysgenetic sacrum. When we go back to our axial images, it is very much there. Here, see, there is a spina bifida here involving the sacrum, and as we see there, even there is a phylum terminal lipoma which is there here, and the cord is getting tethered here. There is tethering of the cord. So, and when we try to look at the sacrum, see the shape of the sacrum. The sacrum is dysgenetic, and the coccyx is seen here. So we have two entities here. One is the urinary outflow obstruction, and another is this dysgenetic sacrum, tethering of cord, and phylum terminal lipoma at the tethered cord. So this indicates a neurogenic bladder. So this is the 3D reconstruction. You can see that the sacrum is dysgenetic, and if you carefully go back to your topogram, we could have identified it here. There is a dysgenetic sacrum. Next line. And when we try to look at the sacrum, see, you can make out this dysgenetic sacrum, and also the spina bifida that is there. It's a beautiful 3D reconstruction which is showing the dysgenetic sacrum, and the patient is about 24-year-old with urinary symptoms. The initial symptom with which he presented was hypertension in young, and the ultrasound revealed hydroureteronephrosis, which led to CT KUB, which identified additional information. Thank you. Dr. Kishan Bhagwat, radiologist, Harapnalli, Vijayanagara.